Hello, എൻ്റെ പേര് ഡോക്ടർ ശ്രുതി സുധാകരൻ. ഞാൻ കൺസൾട്ടൻറ്റ് പീഡിയാട്രീഷ്യൻ BNB മെമ്മോറിയൽ തൃക്കാക്കര ഹോസ്പിറ്റലിൽ നിന്നാണ്. ഇന്ന് നമ്മൾ സംസാരിക്കാൻ പോകുന്നത് ഓട്ടിസത്തിനെ കുറിച്ചാണ്. ഇതൊരു ബുദ്ധിവികാസവുമായി സംബന്ധിച്ച് ഉണ്ടാവുന്ന ഒരു മെൻ്റൽ ഹെൽത്ത് ഡിസോർഡർ ആണ്. ഇത് കുട്ടികളിലെ ആശയവിനിമയ ശേഷി കാര്യമായി ബാധിക്കുന്ന ഒരു അസുഖമാണ്. Autism is a neurodevelopmental disorder which affects child's social interaction, social communication, and they usually have restricted repetitive behaviors. The range and severity of symptoms vary with each child, which is why autism is now referred to as autism spectrum disorders. So the child will have strictly the symptoms of autism. They will have symptoms of Asperger's syndrome, where all the developmental milestones are normal. However, they have mild difficulties in social interaction. Then comes childhood disintegrated disorder, where they have achieved all their developmental milestones, everything was normal until 2 years of age, and then they have lost those developmental milestones. There's also another category which is otherwise non-specified. So they have mixed features. So all these together are clubbed and called autism spectrum disorders. Usually the symptoms start by 6 months of age. By 1 year of age, more symptoms start to come in, and by 2 to 3 years, they would have all the symptoms of autism. There are two main areas concerned with autism. First is social interaction and communication. So here the child has a lot of difficulty in maintaining eye contact. They have a difficulty in reciprocation. That means when you say hi or when you say bye to them, the ability to reciprocate back to us is very difficult if you smile at them or you get angry at them. The next is they are not very empathetic, or they are not much cared about their surroundings or the people around them. However, they show a lot of care towards their primary caregiver, like their mother or father. Now, the third thing is non-verbal communication, which means their ability for head nodding or their ability to frown or to smile or to wave. So that is called non-verbal communication, which is also very less in case of autism. Their speaking skills are also very much limited. So this was social interaction and communication skills. The next comes restrictive repetitive behavior. So that includes body rocking, head bobbing, or head banging that they have. So the next thing is restrictive repetitive behavior. So that begins with body rocking, head nodding, or head banging that they have. They will line specific objects or toys in a straight line or in a specific pattern. And if we try to change that pattern, they will be extremely upset about it. They will also have specific words or phrases that they repeatedly use again and again. Now, in some children, we also see they have extreme curiosity and knowledge about one particular subject, like train or a fridge. So they'll have extreme knowledge about that particular topic. So there are a lot of causes for autism, and this autism has a very strong genetic basis. There is maternal nutrition, which is linked, maternal use of anti-epileptics, which is linked. Then the maternal infections usually that affect the mother in the first 3 months of pregnancy, that is linked. So autism is also having a higher incidence in low birth weight babies, preterm babies, growth restricted babies as well. Now, when we come to the treatment part of autism, we have to know that there is no single drug cure for autism. So we will specifically be treating the child's symptoms. So, and this involves a lot of people. It includes clinical psychologists, it includes speech pathologists, we need a lot of occupational therapy, we need behavior therapy. If the child has symptoms of self-harming behavior, then we'll include the specific drugs. If they have associated anxiety or ADHD, then that specific drugs is also added. Now, if intense therapy is started from an early age, all these symptoms of autism can be greatly reduced, and we can even achieve good language skills by 5 years of age. So that is why it is so important that therapy begins at an early age and we first diagnose it also at an early age. It is important to understand that the diagnosis of autism is never a dead end. We should understand that the child's developmental milestones, especially the physical milestones, their ability to walk, their ability to run, to do other sports and activities, are never inhibited. The only thing that is going to be a struggle for them and as a primary caregiver for you is that they need a little bit more help than the ordinary child. And it is very much possible that with early diagnosis and treatment and intensive therapy, we can bring that child back into society and help him move forward. Do not put a burden on that child and on yourself thinking that it is the end of it. It is not. There is a lot of therapy nowadays to help your child be successful and move ahead in life. If you have a doubt in your mind that your child is going through any of these phases, please bring to the attention of your pediatrician. Thank you.